Can you, okay, you can see it.
Yeah.
Can you all see it?
Yeah.
Yeah, we can see.
Okay, let me just quickly check if the videos play. Tell me if you can hear it.
It's not audible.
Not audible.
Wait.
How about now?
No.
No.
Mega, do you have audio clip
I have
without
it.
video?
Yes, I do on my.
Yeah. Can you share that audio clip alone?
Sure. Wait, not this. World Mental Health Day. So I think the other one also, I'll have to keep it ready over here. Okay, let's just test if this one is working when I play. Tell me if you
Hello?
can see it.
I do.
Can you see
No.
it?
No. We are not able to see it.
Oh, but you can hear it.
No, I think it is Shalini. Shalini was speaking, I think.
No, but could you see the video? I was playing the video.
No.
No?
I think you have to go again, share slide sharing.
Okay.
Just one moment. Just come.
Tell me if you can see it now. Can you see it
Yeah.
now?
Yes.
And can you hear it?
No.
No.
Is it audible?
No. We are not hearing it.
Oh,
No,
God.
Mega, we can't hear the audio.
So earlier you could hear it but not see it.
No, Megha, we are not able to hear it at all.
What
One
do I?
option would be just keeping the YouTube video on in your screen so you can share that if nothing works. Just try checking the YouTube, keep it on.
Okay, how? Can somebody else do this bit? Because I'm not good with this and I'm going to.
No, just like the PowerPoint, you just go to your Chrome or Google or the web and just open the YouTube with the UAE national anthem.
It's this one.
Try playing it.
Okay. Can you see it? No.
Yeah, we can see, but again,
Not audible.
Okay, if it's not going to be audible, it makes no sense. Shall I play it on my phone? I don't know what else to do.
Oh,
did you check all your, the laptop or your gadget
I did.
volume? And, yeah,
Volume,
I'm sure,
everything
yeah.
is on, everything is playing. So
Any setting with your headphone and
no, I'm not wearing any headphones. So
okay. Do one thing. Can you just play audio with some other device?
to sync it will be difficult.
No. Audio with some other device so that audio will be there.
You mean play the video here, but play the audio somewhere else. So again, syncing it will be difficult, no?
No. You need not like have just we can have just audio alone.
Okay, let me just play and see. And you tell me if it sounds
Okay.
professional, then okay.
Yeah, that's fine.
Yeah? Is this okay?
No, we are not able to hear it. That's okay. You skip the anthem now. You
Skip
can
the
directly
answer. Okay. Yeah, sure.
everybody.
Yeah, it's better not to do it if it's gonna be disrespectful, you know.
No, there is a particular button which says share computer sound. You just click that button and then play the video, it will work. On Zoom, when you share screen, there is a button which says share computer sound.
Chris, can you do it from there, from your side?
If I make you a co-host.
I'm trying to do that. Okay, just a second. Because
Okay, let me make you a co-host. There you go.
Okay, share screen.
Am I audible?
Yes, you are. Yes, you are. Try to play the UAE anthem.
Yeah, we'll let you in soon. Yeah, we'll let you in soon. Oh, no. We're just having just figuring out one last thing. Okay.
My net connection is slow. Can you try doing that from your side? Because mine is very slow. It's not even budging. What you do is just click on the button which says share computer sound. Then only the audio will come.
Where do I find the set button? In the share screen?
No, when you actually put share screen, there is a 3 dots saying more. On that, just click share computer sound, which comes as the 1, 2, 3, 4, 5, 6, 7, 8, 9th option. Just before leave and optimize, there is share computer sound.
No,
On
I'm
the
getting
top
only
bar,
live on Facebook, live on Workplace, live on YouTube. I'm not.
No.
Oh, okay. I see where you mean, but.
Yeah. Just cut me off, cut my share screen. You put your share screen, just click that share computer sound, and then it will start playing. That's all. It's very simple. Yeah. Now share computer sound and then play, it'll work. On that black strip on the right hand side end, it'll be a more button. And just before leave and the last option, there is one which says share computer sound. Yeah.
Okay,
now
trying it now.
It'll work. I can hear it.
Okay. Quickly, so I tell everyone to stand when we are playing the anthem, yes? Okay.
Okay. So how do we stand? Then we will be out of the
Yeah, you
picture.
can say that, whether they stand or not, but you can definitely say that.
Yeah, I mean, yeah, sure.
Mega, can you check Kunjaka Boban, a film actor video also?
Yeah, it's there on this. If it's working here, that will also work.
It'll work. It'll work. You just need to prior. You just have to give your permission.
Can you hear this?
Healing Minds is a volunteering organization, a collective initiative
Okay,
of
shall we let
licensed
people
and
in now?
experienced.
I'm getting calls from.
No, let's not. Please let's start. Time up.
Take off the screen.
Yeah, share screen should be stopped or the first to be put on.
Is it gone now?
No, 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 no. You have to either switch off the share screen or just put the first slide. That's all. The first slide is the intro part, and put F5, which is the what you call the show slideshow starts. F7, yeah.
Hello.
Good evening, everyone. We still have some people joining in, so we're just going to take a couple of minutes more and we'll begin shortly.
I think we can go ahead, I think.
Sure.
Please.
All right, we can begin. Hello, everyone. My name is Megha Pai, and welcome to this celebration of World Health Mental Day with Healing Minds. And before we begin, we would like to begin with the national anthem of UAE. So I would request you all to stand and observe your respects.
Megha?
Megha?
Yes, sorry, my screen was freezing. Just give me a moment. Yeah, I'm back. Before we continue, just a gentle request with everybody to put their mics on mute unless they're speaking, as I've been told it's creating a feedback. Hello and welcome. As I said, my name is Megha Pai, and we are here to celebrate World Mental Health Day celebrations with Healing Minds. Well, most of us are very familiar with Healing Minds and what we do. But for those of us who are here for the first time, let me give you a quick run through. Healing Minds is a volunteer-based organization that is made up of mostly mental health professionals who have volunteered and joined hands with Good Samaritans across UAE to provide mental health to people who are in need but who do not have necessarily access to it. We started as a crisis prevention during the time of COVID. So it was a very organic, development that happened, which has grown into something very beautiful today. And we are here to not just celebrate World Mental Health Day, but also to, relaunch our organization into a fully fledged functioning organization. And we also have a very special video with us from a very well-known Malayalam film actor called Kunjako Boban. He has sent his best wishes to all of us, and we will have just in that playing in a moment.
Healing Minds is a volunteering organization, a collective initiative of licensed and experienced mental
Megha, are
health
you
professionals from
trying to
UAE,
share the screen?
consisting of a group of psychiatrists.
That was not audible?
No, it is you are not sharing your screen.
Video was not there.
Oh, just give me a moment. Apologies.
Yes, please. Go ahead.
Megha, audio is not there.
Just give me a moment. Can you hear it now?
No, not yet.
Consisting of a group of psychiatrists, clinical psychologists,
Yes,
counselors,
Megha.
health workers who selflessly put in the time. Healing Minds is a volunteering organization, a collective initiative of licensed and experienced mental health professionals from UAE, consisting of a group of psychiatrists, clinical psychologists, counselors, health workers who selflessly put in the time and effort to serve the people across UAE. On October 10th, which is also the World Mental Health Day, we are coming up with a program to relaunch and extend their free services to wider strata, mainly the middle class and labor class people who are having mental health issues during these pandemic times. It's a unique multilingual program where they provide their services to the needy, irrespective of their language, religion, nationality, or their socio-economic status. My heart reaches out to all those who are associated with Healing Minds for the selfless services provided. May God bless you and good luck.
So that was Kanchiko Boban. And what started as just, a need to help out and reach out to people around us has today turned into a volunteer-based organization that is here to stay. And we plan on continuing our mission of reaching out to everybody in the UAE, and especially to the those who do not have access to mental health, so that they can get the timely help that they need. And together we can grow into a better and brighter nation together. And our mission still remains to compassionately and humanely connect with everybody that is in need around us, so that they can overcome their challenges. So to quickly run through today's program, we will begin with a welcome note by our founding member and psychologist, Dr. Reena Thomas. She will then lead us into taking the mental health pledge, where we will, renew our enthusiasm and our vow towards bringing more awareness into the society about mental health. This will be followed by inaugural note by our initiator and program director, Mr. Altaf Ali. And we will then have a public awareness talk on mental health by renowned psychiatrist and another founding member of Healing Minds, Dr.Shaju George. Um, After the mental health awareness talk, we will have a very interesting question and answer session and panel discussion with some of the best minds in the mental health arena, with volunteers that we are very proud to be associated with. They will be talking about adolescent mental health. So we will have that. And then Isha Mohammed Bashir, who is a program coordinator with Healing Minds, will bring in the today's celebrations. So without further ado, let me introduce you to one of the founding members and really guiding lights of Healing Minds, Dr. Reena Thomas. She has an MPhil in clinical psychology, and she has been practicing clinical psychology in the UAE for about 16 years now. And she's really a beacon of mental health today, and especially for all of us within the Healing Minds community. We really look up to her and seek her guidance from time to time. And she's undoubtedly one of the most dedicated and fiercest advocates of mental health that I have had the pleasure of knowing. So please welcome Dr. Reena Thomas, and she will lead us with her welcome note and the pledge.
Thank you, Megha, for kind words. Good evening, friends. Thank you to each and every one of you for being with us, especially this special day. So on behalf of Healing Minds, it's my pleasure to welcome all the participants over here, families, children, and all others on this special occasion where observance of World Mental Health Day, and also, as Megha mentioned, there's a relaunching of the Healing Minds, our collective initiative. I do welcome all the eminent, I do welcome our special speaker for the day, Dr. Shaju George, and all the other special panelists, and all the other Healing Mind participants also, professionals who are there. There's a lot of excitement in the air, and I'm sure it is all about each one of us and our mental health. So this year, WHO has declared a theme, mental health for all. So that is with a greater investment and greater access. So I believe it is with an intention in mind that to encourage people to invest more in mental health, with an intention that mental health is for all, not to a particular sector, or not only after people who are identified as ill. So rather to identify the psychosocial factors well in advance, and also to enhance the protective factors, and even to establish some community outreach programs with an intention, as I told you, mental health is important for all. So mental health is not just an absence of mental illness. It is more of like rather a good mental health, which I'm sure, which has to be preserved by all of us. and our speaker will be enlightening us more about it in a short time. So you have, whoever has already joined us brought, energy to this program, and I would like to thank again to be with us. And as Megha mentioned, now we are going to take an oath. So start with, I'll be reading out my name, so each of you can take your name. So in that place. So I, Rina Thomas, take a pledge to take care of my mental health, just like I take care of my physical health. I will do my best to change the attitude of the community towards mental illness. Under no circumstances should I speak ridiculously about people with mental health problems. Instead, treat them with respect and dignity. I will give equal importance to mental health and physical health. I will strive to acquire basic knowledge about mental health issues and pass on such knowledge to others in any way I can. So I take my mental health seriously and seek help without hesitation when needed. I will do all that I can to promote the mental health and well-being of the others. I will do my best to live up to the purpose of this pledge and urge others to do the same. Thank you one and all. So let's move to the next program.
Thank you, Dr. Reena, for your very valid words. And if ever your words were pertinent, they are in the times of the pandemic that we are living in. I think mental health has become basic necessity. It used to be considered a luxury, but I think it has become a basic necessity now. Indeed, mental health is not just for the ill. It is for all of us to make sure that we get out of this current situation as untouched as relatively possible. We now move on to our next speaker for the day, for the evening. We will now have the inaugural address from Mr. Altaf Ali, the initiator and program director of Healing Minds. He's also the founder and CEO of Inspired Holding Group, social activist and motivational speaker. He's a man of many, many talents and really the wind beneath the wings of our Healing Minds community. Please welcome Mr. Altaf Ali. Over to you.
Hi, good evening to all. Thank you very much for the lovely introduction, Meka. Good to see everybody on a single platform again after many weeks. I think in between we had few discussions internally, but good to see Dr. Shaju, Dr. Srikumar, a lot of familiar faces, which actually enthralled us during the pandemic, especially the the lockdown period. So the idea behind the entire healing mind was actually being defined. We all know during the complete lockdown started end of March onwards. So there was a need of mental health for those people who are actually being quarantined. That's when the idea actually the seed happened. So from there it took literally few weeks to set up what we have seen as Healing Minds, from the basic logo designing onwards, setting up the call center to organize 64 plus counselors and practicing professionals, and do a lot of exercise and make a complete program on its own. It's completely something I never done it in my life. I think it's something of its own. It's a unique thing which happened naturally. I think we should thank the authorities and the government officials and the system of Dubai, which makes the complete the nationalities and peoples comes together to live peacefully. So that might have directly or indirectly trigger all of us to come together under one platform to support the society when it needs, So it's really beautiful. Even though I'm not connected or directly involved in mental health as a profession or anything in that sort, not even related to the medical profession, but my intention was to do something different because being a mentor and entrepreneur since very early age, I've seen people comes to me to reach out to get the benefits, some monetary benefits, some support in terms of various things. But one of the story actually really inspired me. Somebody who reached out to me many times with small help and things and all. I took some time to sat with him and understand his problems and guide him through what to do, what not to do. This actually helped him to overcome everything, and he never come back to me for any help. In fact, he started supporting all others, and he started saying good thing, that actually that motivation and guidance really help him to do well in his life. So sometimes giving monetary benefits and things and all is required, but more than that, if you help somebody, if you're really able to make his mental health better, that actually support him, or that person or his immediate family, and the ecosystem around him. If he's an entrepreneur, his company and his suppliers, his supply, the employees, everybody is getting better, benefited with this single act. So in that perspective, I thought, mental health is something like the fisherman story. Instead of giving one-time food, teach somebody how to fish it, so they can, earn their meal for their lifelong. That was the idea behind Healing Minds when we started. And touchwood, with the God's grace and everybody's collective effort, we reached, into a very good reach up more than 3,000 calls we managed, and we definitely made a difference to many people's life. We definitely helped and stopped many suicide attempts, many different kinds of violences and abuses and so many things. So my heartfelt congratulations to all healing minders. They really done well. I could only coordinate and do the other operational stuffs, but whatever Healing Minds has done, entire credit goes to the Healing Minds, volunteers. Absolutely. So let's have a real applause to all the healing minders. Many people couldn't join today, but it's all goes to everybody. And coming to the relaunch, it's not a relaunch. We never stopped actually. We were continuously giving our service, but we kind of, since the Vasan facility where we were operating has been converted into humanitarian city. So our daily call center operation has been interrupted. And then Dr. Danesh, he was the person behind, has been, moved to his permanent job. But our system is automated and it's keep getting calls, but nevertheless the depth of calls or the number of calls has been reduced, but it's keep going on. So now we are in advanced discussions with DHA and authorities. So there are requests coming from various corners of society not to stop. Initially we thought of, since the lockdown is finished, pandemic is in a different segment, people are no more kind of afraid and stuffs and all, and market is picking up, things are getting back to normal. So we thought of actually call off the initiative and stop by, but then everybody is encouraging us to continue the initiative. It's a right platform, very good natural platform for the people who are in need, So, and one of the other thing actually cautioned us is few of the experts are saying the pandemic is yet to go. There is still no end of the tunnel yet. And then there will be a big economical crunch supposed to happen, as according to experts. And post that, after every pandemic, based on the historical data, there will going to be a depression time. Great depression is something is going to start. So healing minds is still relevant to pass through that phases as well. So it's not an official relaunch, anything in that sort. We are continuing our service, and once the authorities are on board, then there will be an official relaunch ceremony. We'll definitely do a big shout out, and we're going to have a function to meet and greet all the champions of healing minds and distribute their certificates and other things. We're going to announce the date also soon once the restrictions and everything is normalized. Oh, so thank you very much, and wishing you everybody a well mental health day, and make mental health a priority like we do physical health. Okay, over to you.
Thank you so much, Mr. Altaf. Really, your dedication to our cause is a testimony to just, all it takes is a seed for things to really turn around and for things to happen. It was a seed of intention that you had that has turned into this beautiful garden that is the Healing Minds today. And we continue to blossom. Like you said, we never really stopped. We had been continuing, and we will go from strength to strength here on. And now we come to the main course of the evening. We come to the mental health awareness talk by our very, very distinguished speaker. He has over 2 years of 2 decades of experience, I beg your pardon, in the field of psychiatry. Dr. Shaju George is a specialist psychiatrist in Dubai Community Health Center, Central International Modern Hospital, GMC Clinics, Al Zahra Hospital, Sharjah. And he's associated with such big corporates as Emirates Airlines, Fly Dubai, RTA, MPost, Al Ghurair, to name a few. He's also a fellow of the Indian Psychiatric Society, and he is really a psychiatrist extraordinaire. So please welcome Dr. Shaju George. Over to you, sir.
Good evening, friends. Can you hear me?
Yes, yes.
Yes.
At the outset, I thank the organizers of Healing Mind for this wonderful World Mental Health Day program, for giving me an opportunity to address all our healing minds and people who are interested in good mental health. Let me congratulate the team Healing Minds for a wonderful initiative during the times of pandemic, under the blessings and guidance from Dubai Health Authority, and who could actually help lots of people to bring them back into their lives during these difficult times. We all know that we are still going through the pandemic, and more than 1 million people died out of the pandemic in different countries, and still we are going with this increasing numbers, and even here in UAE. So every year on October 10th, we observe World Mental Health Day, and the theme for this year is basically a move for mental health. Let's invest. So this investment has come from the Healing Minds long time back. That is why we are here as a forum to discuss on what all things we can do in lines of the WHO's objectives as a message on World Mental Health Day. Why should we invest? Why should we concentrate on investing on mental health? We should invest because of these hard realities. Close to 1 billion people are living with mental disorder. That is roughly 13% of the total population of the world. 1 in 4 in the world will be affected with mental or neurological disorders at some point of their lives. 3 million people, they die out of harmful use of alcohol. Every 40 seconds, one person die out of suicide. And depression was the third most common disability in 2017. And the projection was it's going to be the second most common in 2020. WHO says 264 million people are affected with depression. And probably we will not wait for 2030 to become the most common cause for disability. By now, we might have reached that spot. Yes, relatively few people around the world has the access to quality mental health care. And especially in low and middle income countries, 75% of the people who are having mental, neurological, and substance use disorders, they don't have access to treatment. And stigma, discrimination, punitive legislation, and human rights abuses are still very rampant. More than 40% of the countries have no mental health policy. Over 30% have no mental health programs for their country. And around 25% of the countries have no mental health legislation. More than 33% of the countries allocate less than 1% of their total health budgets to mental health. Around and another 33% spend just 1% of their budget on the total health budget on mental health. 25% of the countries, they do not have the most common 3 or 4 medications which we use to treat for schizophrenia, depression, and epilepsy. And there is only one psychiatrist per 100,000 people in more than 50% countries of the world. 40% of the countries have less than one hospital bed reserved for 100,000 people. The mental health resources in 2016 per 100,000 population in UAE, the number of psychiatrists per 100,000 population is 1.649 and psychologists is 0.765. In India, it is 0.29 and psychologists 0.06. In comparison with Australia, psychiatrists 13.52, psychologists 103.3, and United States 10.54, 29.86, and Norway 48 and 73.5. And to my surprise, in Argentina, 22 psychiatrists per 100,000 and 222 psychologists. If that is the case, how exactly the reality is? Yes, for 10 million population in UAE and 1.3 million mentally ill, less than 200 psychiatrists and 100 psychologists. In India, in comparison, in India, 1.3 billion population, 170 billion mentally ill, less than 5,000 psychiatrists and 1,000 psychologists. These are the numbers, hard realities. So that is why in 2008, World Health Organization brought up with an initiative that mental health gap action program. This came in 2008 because in 2008 itself, 14% of the global burden of disease was attributed to mental, neurological, and substance abuse. And most of the people affected in low and middle income countries, 75%, they were not having access. So this program, mental health gap action program, aims at scaling up services for mental, neurological, and substance abuse disorders, especially in lower and middle income, by asserting the proper mental health care, psychosocial assistance, and medication. But still, down the line 20 years, where exactly we are. See how exactly the mental illness is having economical impact. Just now, the Altaf was talking about the Great Depression, which can follow the pandemic. Global economic burden attributable to mental illness in 2010 was 2.5 trillion, and with the projection is it is going to be 6 trillion. That is 50% of the global burden of global economic burden attributable to non-communicable diseases. Global expenditure on mental health need is $2.5 per person per annum. $2.5 per person per annum is the global expenditure on mental health needs. And the ratio between mental health burden and expenditure between the low and middle income countries and high income countries are it's a big difference. So this major gap, this is the major reason for wide gap between mental health needs and the provisions of intervention. So why should we discuss a lot about mental illness? Because this is a study from United Kingdom, and they talk about a year, the loss of income or the financial loss because of the mental illness in a year at workplace is 35 billion, roughly 35 billion. And out of 35 billion, 21.2 billion is because of the presenteeism. People who are having mental illness are not seeking help and going for work, and it is affecting the productivity. 10.6 billion is because of the sickness, and 3.1 billion is because of the staff turnover. So that much is the importance of the treatment of mental illness, seeking help for mental illness. Otherwise, it is having such a financial and economic impact. Why people are not seeking help? We know very well that mental illness is probably one of the most common medical problem which is not covered under most of the insurance policies. World Bank says strong mental health builds human capital. So they say it is critical to ensure mental health programs integral in the service delivery at community level and covered under financial protection arrangements. So there should be policies in place. Then only people will who can seek help and will become better. Yes, we were talking about Great Depression. What exactly is waiting for us? In 1930s, when the Great Depression happened, it had such a negative psychological talk. Psychiatric offices were packed with in early 1930s with people from upper and middle socioeconomic category people, and confidence of the average American fell to general malaise and inertia as the unemployment grew and the economic mayhem. And people waited for something to happen just now, just like we are waiting now, spinning in circles, and they fought to survive. And what they have seen is the national suicide rate. It was a skyrocketing of the suicide rate from 13.9% to 17.4 per 100,000. Yes, Corona or COVID-19 is the great divider of the history to pre-COVID and post-COVID. The hard reality is again 2020 billions of people around the world are affected with COVID-19 pandemic with a big impact on their people's mental health. As already the access was limited to the and affordable mental health was limited even for the pandemic, which has been further diminished due to COVID-19 as the pandemic has disrupted health services across the world. The reasons are infection and the risk of infection in long-stay facilities such as care homes and psychiatric institutions, and barriers to meeting people on face-to-face, mental health staff being infected and with virus, and the closing of mental health facilities because of the infection. So how does the COVID is affecting the general public, or how exactly it is affecting now each one of us? Increased symptoms of depression, anxiety, and stress related to COVID-19 as a result of the psychosocial stressors such as disruption of life, fear of illness, and fear of negative economic effects, which we have already seen. At least in my clinic, I have seen threefold increase in new cases. Phobic anxiety, panic buying, binge watching television, which has been associated with the mood disturbances, sleep disturbances, and fatigability and impairment of self-regulation. Social media exposure associated with odds of anxiety and combined depression with anxiety. And quarantine also presented with the whole lot of stress, anger, and increase in risky behaviors like online gambling, gaming, and things like that, and especially younger people. And we could also see an increased use of alcohol and other substances and domestic violences and increased number of divorces. How exactly it was affecting the COVID-19 positive clients and post-COVID-19 clients. And good number of them presented with PTSD, post-traumatic stress disorder, depression, anxiety. And those people who had gone through the ICU during the COVID period, they have developed post-intensive care syndrome, which comprises cognitive, psychological, and neurological symptoms. And how exactly the COVID has affected those people who are already having the pre-existing mental illness. early discharge from the psychiatric units and disruption of face-to-face psychiatric care has resulted in relapse, suicidal behavior, and lack of access to medical care and social isolation. Quarantine and lockdown has increased the symptoms of anxiety and depression and high rates of PTSD and insomnia. Physical distancing reduced the availability of many family, social, and psychiatric supports. And people with serious mental illness and associated socioeconomic disadvantages are particularly at risk of both direct and indirect effects of the pandemic. How exactly it has affected the mental health workers or the healthcare workers in general. Depression, anxiety, distress, burnout, more incidents of all these different kind of behavioral disorders, mental health issues among healthcare providers. So, yes, we are going through the whole lot of the mental health issues, but some of them need some special mention. This will help at least the general public who are attending this program. Because for mental health professionals, they all know that what exactly and how exactly it is affecting and how exactly the situation is. But just for the interest of the public, I'm discussing some of the common mental health issues, which basically we see as during these days and even before, and with increased numbers during these days. Yes, we have seen only the tip of the iceberg during this pandemic. We are yet to see. Insomnia or sleep problems, in general, it is 6 to 10% of the total general population. Children need 9 to 11 hours of sleep, adults need 7 to 9 hours of sleep, and we need to learn to prioritize it because it is the most rejuvenating thing. And one of the most important things to get proper sleep is practicing sleep hygiene. Anxiety or panic is another common behavioral issue which we come across these days. And roughly 3.8% of the total general population, they do suffer from different kind of anxiety disorders. Panic attack is extremely common anxiety disorder in GCC, especially in UAE. In any anxiety situations, since it is creating anxiety and fear, we will have a tendency to avoid, which will help us on an immediate basis, but on a long-term basis, it is not helping us. So avoidance is the key, or get exposed is the most important thing. Depression is the most common disability, probably by 2020 itself. It was second common to the cardiovascular disorders, and now it is going to be the most common. 264 million afflicted. It's a statistics not during this year, before to 2016, and now it will be even more. 3.4% with a range of 2 to 6% is affected. More women are getting affected. And some of the key symptoms which may help you to identify that whether you are going through depression is anhedonia, or inability to experience happiness even when I have everything in my life. Getting tired and fatigued very often, unlike before. And mood variation between morning and evening. Early morning hours I feel very low, and towards evening I feel bright. And early morning awakening, I go to sleep, but 2 o'clock, 3 o'clock, I'm up and I'm not getting sleep. These are some of the common symptoms of the depression. Alcohol and substance use and drugs, these days it's becoming rampant among youngsters, especially the substance and drugs. With regards to the alcohol, it is roughly 1.4% of the total general population, and it is one of the common causes of suicide, probably the third most common causes of suicide. Understand that this is not a habit, but it's a medical illness. Earlier the onset of substance use, earlier the complications. And there is a genetic element also, it runs in the family, and the spouses or the family members of those people who are using substances should understand the fact that they should get away from codependence. Then only the person who is dependent will be able to come out of their problems. And anonymous groups, including Alcoholic Anonymous, they play a major role in coming out of these kind of problems. ADHD is one of the most common reported behavioral issue among children and even among adults. Roughly 2.2%, ranging from 0.1 to 8.1%. Probably it is one of the most overdiagnosed and misdiagnosed condition. Attention deficit, hyperactivity, and impulsivity are three major core symptoms. And diet is not having no established role as of now, as per the latest the reports. Maternal and postpartum depression probably underdiagnosed and underreported. 13 to 20% of new mothers are going through the postpartum depression, develops within few weeks after the delivery, and generally, and it should have developed within a year. And it is completely different from baby blues, which is quite normal, and it's almost 60 to 80% of mothers can go through baby blues, which will get subsided within 10 days. And the difficult part of postpartum depression or the complication is they may harm their own baby, and they may have suicidal ideations, and they may commit. And the chance of recurrence in future pregnancies are high, roughly 30%. Personality disorder, another common issue, difficult to tackle. Personality disorders in general are difficult to tackle because the person who is having personality disorder may not have insight into their issues. Even though it is considered to be a minor, it's a major, considered to be a minor behavioral disorder, something which is very difficult to manage with. 1.6% of the total general population, it's more in women. Intense but unstable emotions and relations, impulsivity, chronic feeling of emptiness, suicidal gestures and attempts, one of the most difficult behavioral condition to treat. Dialectical behavioral therapy is a type of cognitive behavioral therapy which helps in dealing with this kind of behavioral disorders. PTSD needs special mentioning, especially during this pandemic. We have mentioned that people who are going through COVID and who had gone through COVID, they can have, they can develop post-traumatic stress disorder. Roughly 2.1 to 9.2% is the world population prevalence of PTSD. Exposure to significant trauma is a must. Intrusive memories of the trauma, distressing dreams of it, flashbacks of the incidents, avoidance of those situations which can basically remind them those memories, negative cognitions, and marked alterations in arousal with fluctuating BP and pulse rate, and eye movement desensitization and reprocessing is one of the treatment modality which is effective in the case of post-traumatic stress disorder. Of course, probably more than the COVID as a pandemic, we should discuss about suicide as a pandemic. Even before COVID-19, roughly 800,000 people were committing suicide every year. We are talking about pandemic like COVID once in a decade or once in 2 decades, but every year we are losing at least 800,000 people due to suicide, and then definitely it need to be considered as a pandemic. One suicide in 40 seconds. And the projection is 1 in 20 seconds by 20 seconds. So we have already reached that one suicide in every 20 seconds. Good number of the suicides are preventable because most of the successful or completed suicide are because of the depressive disorder, which is a treatable condition. So always remember, if there is a doubt that any of your family member or friend or a colleague or whoever be the person around, if they have the risk of suicide, please don't hesitate to ask. Please ask. It will actually reduce the chance of incidents. And try to become a befriender, and then you can save a life. Relational problems or relationship problem is another important issue, especially during pandemic. We are seeing a lot of domestic violence and divorce cases, and these type of cases are on the rise, a rising number of divorces. And to a greater extent these days, gadgets and extramarital relationships playing the role of a big villain. And poor, ineffective, or unhealthy communication is the most common cause of conflict in most of the relationship issues or relational problems. This is something which we couldn't avoid to mention, because internet or game addiction, until these days, until the days of pandemic, we were basically asking our children to stay away from gadget. Nowadays, unfortunately, we don't have any other option other than to give them the gadgets, because they are living with gadgets, sleeping on gadgets. Yes, they are 24 hours, 365 days, and last 9 months, they are on their gadgets, and the chance for getting addicted to internet and game are highly likely, roughly 0.3% to 3 to 1%. It's a behavioral addiction, which the latest inclusion into DSM-5, and features like the addiction features are just like any other addiction. So what do we need to do basically? If you're going through a behavioral problem, what exactly we need to do? We need to acknowledge that, yes, I have a problem. Then we have to accept it. Then once you have the acceptance, yes, help is available around, seek help and get well. So why I should consider this as an illness? So how exactly the mental illness evolved over a period of years? In the Middle Ages, it was considered as a result of supernatural forces and demonic possession. Probably that is one of the major reasons for this much stigma towards mental health. And the medical model, which was suggested and proposed by R.D. Lane, came in early 20th century. But the current biopsychosocial model, where the biological, psychological, and social aspects were given equal importance, which came in 1970s. So the current model is we should focus on all three aspects. It is no longer a supernatural or demonic, no longer a pure medical model. It is a biopsychosocial. So what are we aiming for by investing in mental health? A state of well-being. Mental health is a state of well-being in which the individual realizes his or her abilities and can cope with the normal stresses of life and can work productively and fruitfully and is able to make a contribution to his or her community and is not just the absence of the mental illness or disorder. So how exactly this can be achieved? We are providing a comprehensive care, or the treatment should be a comprehensive care. Lifestyle changes, counseling or behavioral therapy, medicines or biological treatment. I generally say in that order for any behavioral disorders. Lifestyle changes first, counseling and behavioral therapy, medicine and biological treatment. Probably we may have to go for a combination of all the three. Who are all the people involved in taking care of the mentally ill or behaviorally ill? Psychiatric social workers, clinical psychologists, and psychiatrists. And remember, it's always a teamwork. So we should know that what exactly we are aiming for. Again, we are aiming for recovery, rehabilitation, and reintegration. We should know all these three terms when we talk in terms of the treatment of the mentally ill. We are not talking only about the remission of the illness. We are talking about recovery, rehabilitation, and reintegration. What is recovery? It's a way of living a satisfying, hopeful, contributing life, even with the limitations caused by illness. What is rehabilitation? Focuses on people regaining their valued roles in their communities so that they have success and satisfaction. What is reintegration? It's a part of the process of rehabilitation that allows people to assimilate into daily life. So our aim is basically to focus on recovery, rehabilitation, and reintegration, and not on remission of the medical illness. So what is the situation currently in primary care setting? Because we should know that how exactly and what exactly is going on. 50% of the population experience at least one mental disorder in their lifetime. At least 25% have suffered a mental disorder in the past 1 year. Where exactly they go? 1/3 of all general practitioner consultations have a direct and explicit psychological component. That is 30% of all general practitioner consultations have a direct and explicit psychological component. But the rule of diminishing half says only half of the patient with a threshold disorder are being recognized. So 50% are going unrecognized. 50% of those recognized are getting the treatment. And 50% of those who are getting the treatment are having the proper treatment. See, 50% are going unnoticed or unrecognized. 50% are getting treated, only 50%, and only 50% are getting the right treatment. This is the gap. So what exactly, from where exactly we need to start from? We need to start from educating and empowering medical professionals. The medical curriculum has to be revised. When I did my MBBS, there was the medical curriculum for MBBS had 15 days of clinical posting in psychiatry. But unfortunately, no questions for theory, no theory exam, no practical exam. Practically, no student or good number of the students were not attending the behavioral science clinic during entire 4.5 years of training and 1 year of internship. So the curriculum, of course, in India at least, they have changed the curriculum, revised the curriculum. Interdisciplinary dialogue, good number of doctors, they don't have, from other disciplines, they don't have any idea regarding what exactly is mental health and what exactly is the mental health problem. That is why this many number of clients were going unrecognized or undiagnosed. Even among the mental health professionals, we do talk in different ways to our clients or patients, and definitely we should have interdisciplinary dialogue also to have a comprehensive care and to be on the same page to deliver the right care for the mentally ill. What exactly the prerequisites for a comprehensive care model? It should be available and it should be accessible and it should be affordable. Availability, we have discussed what exactly is the situation across the globe. Access, then definitely we'll be knowing the difficulty of being the care accessible to others, and affordability it's a great issue, especially when it is not being covered under insurance and the consultations are costing a lot. So why we are facing the whole lot of issues? There are a lot of barriers. There are structural barriers, treatment gap between other medical illness and behavioral illness. Weak public health policies and low priority on mental health. System grossly underfunding, weak planning, abandonment of people with mental health problems by public health system because they are crazy, insane. Why should we? Health culture, we have a nature of labeling. Yes, he is crazy and insane, no point. Widespread lack of knowledge about mental illness, even among the other medical professionals. Underuse of services by users because of their ignorance, and use of ritualized practices and alternative medicine in place of the proper treatment. Illness cost, imbalance between GDP per capita and the direct cost per patient, because we are not spending, we have seen that less than 1% of the total healthcare budget we are spending on mental health. Treatment costs are exorbitant, and for them it's difficult to seek help because of the cost. Privatization of the care and benefit society. So government in general across the globe, the good number of countries are not paying attention to this area and they're not ready to fund. Rehabilitation management barriers, shortage and low qualification of professionals. The other day there was a discussion or one of the psychiatry group in India. One of the psychiatrists was asking, is there any good rehabilitation center where they provide the good rehabilitation in southern part of India? It's a southern part of India, especially in Kerala. The answer was no. There are no proper good rehabilitation centers. If you go across the globe, across India, you may not see a very good rehabilitation center except one or two. So shortage and low qualification of professionals, insufficient community resources, overcrowding of psychiatric wards, and discontinuous care. Biomedical model itself had created a lot of barriers because it was not paying attention to psychological and social factors. So, and prioritization of medicalization. Every person who is having behavioral problem, psychiatrists and GPs and the medical professionals, they had a general tendency to put them on medication, not to pay any attention to other aspects. And investment only in psychiatric macro institutions rather than investing on community and rehabilitation centers. And care provision and families were overloaded with their other budget, economical needs. They always considered that rather than giving care to this and looking for other opportunities where this amount of money, this amount of the human manpower and man hours can be utilized in a better way. Little social support and the barriers to family participation by the existing system. So these are the barriers basically resulted in poor care of the mental health professional, mentally ill patients. So what exactly we need to do? We need to have dialogue with policymakers. We, in the sense, mental health professionals and even lay persons. On what all areas we need to have dialogue? We need to have a dialogue with the government to draft a mental health policy, a mental health act, a good mental health program, and allocate funding. And as a regulator, the government should give direction to the insurance companies to coverage for mentally ill patients, and to open up more mental health facilities, including rehab centers. What all things we can do or we can learn during this during these days, and how exactly we can be of help for those people who are having mental illness or behavioral problems. Probably mental health first aid is something which we should revolutionize so that more people will get equipped to be a good befriender or a person who have first aid worker who can actually be of initial help until he reaches a properly trained mental health professional. We all know that what exactly is mental health the first aid. It does not teach people to treat or diagnose mental health or substance use conditions. Instead, the training teaches people how to offer initial support until appropriate professional help is received or until the crisis resolves. Yes, let us learn to become a befriender. An emotionally a person who a befriender is a person who befriend. An emotional supportive relationship which one-to-one companionship is provided on a regular basis by a volunteer for an individual with distressing physical or mental conditions. Yes, let us learn to become empathetic listener, the capacity to understand or feel what another person is experiencing from within their frame of reference. That is the capacity to place oneself in another's the other person's position. Let us start more support groups on different areas of behavioral ill conditions, because these support groups, people will have more acceptance and they can take more help through these support groups, because they don't feel that stigma or discrimination. Members provide each other various type of help, usually non-professional, non-material, for a particular shared, usually burdensome characteristics. Members with same issues can come together sharing coping strategies to feel more empowered and for a sense of community. These are my golden rules for four things which anybody should acquire, or which we can give or instill to anyone to empower any person. Make them or let us be a person of very good self-esteem. Make every person be a healthy or a very effective communicator or a person to engage in dialogue. Help them to learn survival or coping skills. Help them to be a person with good emotional quotient. What and where we should invest. Of course, WHO is asking us to invest on what, on where. What to invest? We should invest time. We should invest our emotions. We should invest empathy. We should invest knowledge and our wisdom. And we should fund. These are the investment which has to come. Where exactly we should invest? We should invest on individuals. We should invest on families and communities. And of course, we need to invest in schools, because they are the places from where the next generation, the future generation is acquiring all these skills and learning how to deal with. And we need to invest in our present healthcare system. Yes, this year in 2020, World Health Organization has given us a great message: mental health for all, great investment, greater access. It's for everyone, everywhere. Thank you.
Thank you so much, Dr. Shaju. That was indeed a really, really insightful presentation. You have your ear to the ground, and it really showed in that presentation. And I think you just, in your, very brief and succinct manner, you've just given us the past, present, and the future. And if anybody were to try and understand anything about mental health, I think this presentation can just be presented to them. And I'm sure our peers will agree here today. That was very, very informative to not just us as mental health professionals or people who are related to the field, but even to people who are not. So thank you for that. And I think everybody who is here today is better for it. Now we are moving on to the next equally interesting part of our celebration.
Excuse me, if there is any doubts regarding the presentation, if please give it space.
Sure, yes. If anybody has any questions or anybody wants to make a comment, just if you can unmute yourself or write in the chat box.
Hello.
Yes.
This is Dr. Srikumar here. Shaju, that was excellent. Do I have a few minutes to comment on that and the whole thing?
Absolutely.
Okay. So first of all, my comments on healing minds. Of course, it started with all of you with the name given by Dr. Shaju himself. And see, I was looking at it in one way because I was not very active. Of course, some calls came in, but then I was not so very active in that. But today when I was called, I thought, okay, I should look into it. And I was a Rotarian, and probably I am still a Rotarian. I don't know whether they have sent me out. So in Rotary Club, when they do something, some charity, some kind of work, they look into 4 questions about that event or that issue and the actions to be taken. The first question is this true? So when the healing mind started, is this true? Is there a problem there? Yes. Answer is yes. And is it fair to all concerned, like to have a group like this and do things? Yes, it was there. Will it build goodwill and better friendship? And it has done it within ourselves and within from between ourselves and others also. And will it be beneficial to all concerned? And I think definitely it has been beneficial to all concerned, and even now it is beneficial to all concerned. Coming back to Dr. Shaju's, as usual, his thing was so eloquent, and some people say it has been concise and comprehensive. Yes, it fits into both. So it is there. And yeah, coming to our topic of the day, or the World Mental Health Day, mental health for all. See, the time since the World Health Organization gave a definition for health, mental health was there in it, always. The mental health part, even mental, spiritual, and emotional, what you call social health was there in that, but only the medical part of it was, physical part was, it was always, addressed. Second thing is, then there was a slogan that health for all by 2020. 2080. And that also unfortunately didn't happen because mental health still was not the thing. At least now we are happy that the World Health Organization and World Mental Health Group has said that yes, mental health has to be for all. And that's a very good thing. And Shaju has given us a very good, overall view of what it is and what it should be and how we are supposed to go about doing it. One thing I want to express is, he said something that there is no real good rehab center in India. I completely agree with him, and I have an anecdote to tell, which I should not actually tell in public actually, because when I was working in one place, I was a government psychiatrist, and there was one a person, probably he had schizophrenia. He was on the road. He didn't have a house. He didn't have anything to eat. He didn't have anything to wear. Only one companion he had was one dog. And whatever people gave to him, he used to share it with the dog and lie on the shop floors. So I had taken initiative to start a psychiatry unit there. So the municipality, those people got very interested, and they said, see, he's a very prominent person there, though he's not prominent in the other sense, but everybody knew him. So why don't we take him in and treat him? My one question was what Dr. Shaju asked. Yes, I will treat him. Probably he might become all right also. What next? Are you going to provide him with a job? Are you going to provide him with clothes? Are you going to provide him with food? Is there a rehabilitation process or a thing? The answer was no, and they immediately left. There was no further inquiry about that. So that's very true. So when we talk about treatment and other things, the next step also should be planned and it should be ready. Otherwise, whatever we are going to do or what we are doing may not have the desired effect or result. Yes, Dr. Shaju, thank you for that. And I think let's go forward with the.
Thank you,
Dr. Shaju, thank you so much for your comments, Dr. Srikumar. We really appreciate it, and we look forward to hearing more from you. I believe you're joining our panel next, so we look forward to that. Dr. Shaju, if I may, I have a question for you. In fact, as it happens, I'm a student at UAEU University. And well, being an expat, it's quite an interesting experience because, you know, it's very recently that we were let in, and it's quite interesting. And I'm seeing it evolved, you know, on a real time basis. And we were actively discussing today about how you know, when I say fight, I don't mean literally, but whose responsibility is it to make sure that mental health becomes available to more people? I mean, it's many pronged problem, as you pointed out rightly. You know, one part, it is people not having enough awareness, and then there is the taboo and the stigma. It is the lack of, you know, it being covered with the insurance, you know, it being expensive for some people, and some people not thinking that it is worth investing in. They could afford, but they don't want to. To, you know, completely, there is a section, and this is where Healing Minds, of course, is coming in to fill in some aspect of it. But I'm just thinking as a larger picture, how do we tackle this? You know, where do we break this vicious circle of, you know, sort of like a stalemate situation that's going on? Is it the government that comes in? Of course, I mean, DHA is supporting us, so of course I think Healing Minds in a way is trying to break that status quo. But what more can we do to actively change this situation?
I think the initiative has to come from the mental health professional themselves, because no other professional will be able to understand the depth of the issue and the graveness of the problem. So anyway, we are creating such fora and we are discussing on this fora, and definitely people like Altaf can coordinate such efforts, even when he is not a mental health professional, because there are people we need people who are having skills to coordinate and take up matters to the policy level, to the policy makers. So, but we should be able to give them the right expert opinion on the subject, like what all things we need to focus on. Only with the constant effort, things will change. Again, if you compare the situation back in India and UAE, India, we started having all these different kinds of institutions who teach the psychology, psychiatry long time for a very long time. Even then, the situation now in India is, we can say that it is pathetic. So it took these many years to reach this state. Still, it is pathetic. So definitely, more time will take to reach the ideal or the more the expected level. But small steps we can put, and these baby steps will definitely take us to the expected level, at least in coming years or probably in a decade.
Brilliant. Of course, yes, Dr. Srikumar.
Yeah, just one addition to that. See, our efforts should be complemented by the government's effort also. He commented on India. We know that we had an Indian Lunatic Act in 1912. And the next act came only in 1987, just imagine. And that was because of the lack of cooperation from the government or the politicians or the bureaucrats. Yes, the mental health professionals were trying to tell, but of course they were not as pushy, or they were not providing as much as information to them, or telling them about the importance of it. But then just imagine, 1912, Indian Lunatic Act was made by the British, and our act came in 1987. And then came in 2017 came another act where the suicidal attempt was decriminalized, and so many things can happen after that. So it's taking so much time. See, 1912 to 1987 to 2007. So things are moving at a snail's pace, because, like rightly he said, yes, we are not giving enough information. We are not giving enough reason why it should be changed. And of course, the priorities of our bureaucrats and the politicians are also there. So maybe we'll have to go to that direction also, to be behind them and get it done.
Absolutely.
That is true. Well, I think we will all continue to figure this out. And for all the reasons that you all have mentioned and that we've discussed and in the presentation, Healing Minds becomes even more relevant. Now, moving from one sort of pandemic situation, silent pandemic, if we can call it, to another, which is that of the adolescents. You know, I mean, many of us, being mental health professionals and experts, would know that 50% of the mental health illnesses that that show up in an individual happen by the age of 14, and yet most of it goes undiagnosed. So one of the most important areas that Healing Minds team has decided to focus upon is adolescent mental health and awareness of mental health in that age group. So now we may move on to the next order of events, which is a Q&A session and panel discussion on adolescent mental health with some of the brightest minds of Healing Minds. The panel will be moderated by Dr. Chris Venugopal Iyer. He's a clinical hypnotherapist and consultant psychologist. Joining him on the panel will be Dr. Danish Gopalan, consultant clinical psychologist, NMC Royal Hospital, Abu Dhabi. Dr. Abdul Salman Chalil, apologies if I didn't get your name right, Dr. Salman. Clinical psychologist and at Zahra Hospital in Sharjah. That's Dr. Abdul Salman. And then we have Dr. Srikumar V. Nair, whom we just heard from. He is a specialist psychiatrist currently with Mediclinic in Al Garhood. And he used to work previously with NMC for about 15 years. We also have with us Ms. Shalini Krishnadas Nair, CDA licensed psychologist. Currently, she's pursuing her PhD and she's working as a school counselor in GEMS Winchester School. And last but not the least, we have psychiatrist Dr. Pooja Gaonkar Mayankar. Now, she is working currently as a general practitioner doctor in COVID camp in Varsan with the Dubai Health Authorities. So really, she's in touch. She's on the, the front line, as it were. And she is fighting the good fight to make sure that we all come out of this relatively safe and secure. And over to you all, and let's see what you have in store for us.
Thank you, Megha. Let me just wish everyone a very happy Mental Health Day. It was about 7 years back when I met Dr. Reena Thomas, when she was a panelist, when we were talking about depression on a Mental Health Day in the morning show of a radio station where I met her. And Healing Minds came to me through her. So wishing each and everyone a happy Mental Health Day. Let me start with one thing which you would all agree that we are all overgrown 6-year-olds. Our growth till 6 years, we gather everything. And after that, whatever happens is what we had till 6 years. So for overgrown 6-year-olds, let me start with a very short and sweet story and we'll move on to the panel discussion. A teacher went to a few students and he said, imagine you're walking into a forest and the forest is so dense, you get lost. And you have a tiger in front of you. So what would you do? So the first student said, I will fight the tiger. The second one said, I will run as fast as I can. The next person said, I will climb trees and escape. And the fourth one said the right thing. I will wake up. Because he had asked to imagine. Most of our problems is in our mind. We create it in our mind, and most of my patients who come to me these days, they come with the mind problem rather than having an actual problem. So it is right to address the adolescents because recently, for the past 3 days, I've been meeting one patient after the other, most of them adolescents, and they're having questions on laziness. They are having problems with sleep cycles. The circadian rhythm is upset, and they're having problems with relationships with their parents, and all sorts of problems, all that starts with one thought in the mind. So I would like to start off with a very nice question which should come to the whole panel. A 13-year-old asks, sometimes when I get angry, I get into fights and break things. Everyone always tells me not to be angry, but no one tells me how not to. So this is the help what is wanted. And my previous patient 3 days back is a 16-year-old boy who actually tried to commit suicide just because his sister got angry and scolded him. That is to the level of problems what we are facing right now. And I'll start off with Shalini Nair. I would like to address this question to you because you've been dealing with kids, and UAE has all sorts of, every school probably has a student counselor. So I would like you to start off giving your ideas on this 13-year-old's question of how not to get angry. I would like you to unmute, please. Shalini ma'am, I'd like you to unmute so that we can hear you.
Thank you, Chris Venugopal. Thank you so much. And thank you for reminding me it's mute, because I was so lost in all the information that all of you have put, that in spite of being a part of the mental practitioners, we still have so much to do, and there is so much of responsibility on our shoulders. I choose to be a school counselor only with the emphasis that we could identify at the earliest. I believe that early intervention is the best practice to begin with. And I think to be in a school with children and understanding their complexity, especially dealing with adolescents, I think there's a lot that we can contribute to their growth. I tell my students that hats off to that complexity, you know, whether it's puberty, the hormonal changes, the psychological development of self-identifications, and all these, and added with their academic pressure, they are more at a risk of mental health. And I think they need the most support at this age compared to any other age. With the question that has come with anger, I think we need to educate our children. It's not wrong to get angry. It's just a normal emotion. The problem arises only when it is expressed in a harmful or hurtful manner. So I think we have to accept that.
Would you say that there is a parenting issue also in that?
Come again, Doctor? Yeah.
Would you actually say that there is a parenting issue along with that?
I think it is part of growing up. Like I said, there is a psychological development at the adolescent stage where children want to identify, or, you know, there is a search for self-identity. And that's when the moral compass, or, you know, the parent as a God figure, there is a slight switch from there where they want to fight for the rights and the wrongs. They're learning, they are in a knowledgeable environment. So they try to question a lot of rigidity in the parents' structure of discipline or growing. And I think that's when the arguments or disagreements happen in most of the home. And the one way of depicting disagreement is by anger. But it could be an emotion that is hiding a lot of other emotions to deal with self-esteem, a fear. All those things are actually hidden under anger. So I think understanding anger would be the first step for students. And I think we need to role model as well why anger is harmful, because the impacts are affecting your career, your success, your relationship, and how it can be dealt or expressed in a more positive manner. We want to be angry. If somebody is being hurtful to a child or an animal, I think we all should be angry about it. But how you express that anger is how we can teach our children to deal with that in a better way, I think.
Yeah, I do agree with that. And Dr. Danish, I'd like to come to you with that. Is it possible to channelize anger into competition, or anger into success, or any kind of other emotions? Like, does counseling work on anger? Again, we would like things to be heard. It's mute. Though mental health issues are unheard mostly, let's not do that.
It's a great part of this, like, and definitely, like that anchor may be as part of something else as well, as you rightly suggested, that maybe child might have something like ADHD issues or something like. So maybe we can take anchor as an energy. Maybe we can very well channelize it is through, like we will say, sublimation, right? We can channelize through more positive way, like he can involve in sports, he can use that energy into something else very positive about it. Of course, that can be done. And I would take it as another skill, like not getting angry, or like Shalini mentioned, not getting angry, like maybe like get angry when, where, how, and all. That's a skill, like how to get angry. So I will take rather in a skill training program kind of things, maybe like we will teach them how to get angry.
So
Not
probably we'll need not anger management sessions, anger development sessions.
yeah, maybe like like how to, maybe we need to normalize it, rather say like not to get angry. Instead of that, we will train him how to get angry. So that may be the line of approach, that may be like maybe like to reduce the impact of the anger.
Right. Dr. Srikumar, I'd like to again add on one thing. You were talking about the Lunatic Act being archaic, it's old.
Yes.
Sadly, the IPC we are studying now, like I'm a law student, so the IPC we are studying is 1860. The Contract Act is 1882. So we have been totally archaic. It's never been done anything more. So at least if we had something in 1987, it would be much more better. And I think that that's the fastest growing. Now here, like supporting somebody in getting mental health, that is an issue which needs to be addressed in different ways. So as a psychiatrist, do you actually feel that any person with a normal skepticism can move into paranoia or move into schizophrenia, or does it grow day by day? So how and when it should be detected? Should it be detected at the adolescent or the childhood state, or you need to wait till the person gets adult?
Okay. Let me take it from where Dr. Shalini has said, and others have also contributed to the same thing, that anger is a normal emotion. It's not something which is abnormal. And what I would say, from my experience, what I would say is that anger does not come by itself. There is an underlying emotion. Either it is sadness, either it is anxiety, either it's fear. There is an emotion behind that. Reason might be something different. The reason might be like something else. So first thing we need to do and talk to the child is to make him understand what anger is and why is he angry and what has led to that cause. And if they can understand that, yes, I think the next part will be easier. That's one thing. Now, the question you asked, definitely we need to look for signs and symptoms in adolescence itself, because that is a phase where they are changing from what they are as children to adults, and they are nowhere. They're in between. They are neither accepted by the children, they are neither accepted by the adults. And the emotions and the problems are not addressed properly. They have questions there. There are so many questions there, and nobody gives an answer for those questions. And like you said, these can obviously develop into paranoia or skepticism or whatever you call it in due course, according to how they perceive it and take on. So yes, it has to be addressed before it starts. And I think there is a concept of what do you call prodromal paranoia or prodromal psychosis and things like that, which addresses it actually. It is a beginning to that.
Right. Dr. Salman, here there is a question that I don't have many friends. I feel shy. So how do I make friends? So probably the books like How to Win Friends and Influence People has gone outdated, and we need a professional help on the level of making friends and shyness. Could it be a mental issue, the person being shy, or is it something which can be addressed in a better way?
Yeah, am I audible?
Yes.
Okay, thank you for the question. Okay, many times we are forgetting one thing. Persons are unique. Each person has their own uniqueness. Suppose a child is growing from a family, there is a bigger role of their parents. So a mental health professional must be understand which kind of family atmosphere that child is upbringing. One thing. The second thing, what about the nature of personality of the father and mother? What kind of atmosphere they are providing that child to come outward to present his behaviors. So this atmosphere, once we are understanding, then we can easily to understand the child also. So there is one thing, we have to listen that child carefully, then we will get to know which kind of style of coping child is taking in adapting his own level in atmosphere. So that time we can help that child in that way. So as a psychologist or mental health professional, we have to more focused the environmental interaction between the child and parents and the family system. The second thing, what kind of biological uh, uh, things are going in the hereditary basis of that family. So we can helpful to guide that child in that scenario. Then another thing, we can promote that child to go with each time with the situation, what kind of thinking he has generating. So sometimes people are greatest role interaction between the thinking, emotion, and behavior. So we have to understand that child, what kind of thinking he is generating in each situation when he is meeting with other people, or he is just taking any task for solving the issue. So that time we will get the exact idea what kind of nature he is using every time. On the basis of that, we can promoting some kind of treatment guideline on the basis of that child getting reduce all these issues.
Thank you. Here, another question which interested me. It says, my best friend is sad because her parents are getting divorced and she cries to me all the time. How can I help her feel better? Now, another question I'd like to add along with it is that, is it not a kind of priming a thought in that child that probably her or his parents also could be getting divorced on that basis? Because I've had instances where one adolescent child is actually saying that probably my parents are going to get divorced because they are fighting. So the concept, how early should we understand the concept of divorce, and how clearly it should be explained to kids? I'd like to put this question to Dr. Pooja and also to Dr. Srikumar, because I need to get a psychiatric as well as a psychological point of view. Did we have Dr. Pooja?
I believe Dr. Pooja got disconnected. We are still trying to reconnect with her, but I think she's having trouble.
Dr. Srikumar,
yeah,
I'd like to put that question to you straight away.
The same question you mean?
Yes, because I wanted both points of views. Yes.
See, now the question was like, how early should we teach or make them aware of the concept of divorce? Is that what you meant actually? To prevent this?
Yes.
Okay.
Yes.
Now, see, I don't know. I mean, my understanding of the child psychology, and I believe that they really understand what is death and life and all those things by age of 8 or 9 only. That's what I understand. I don't know. The psychologist can correct me if I'm wrong. So yes. So going before that and teaching them that this is like this will be, I don't think it will be beneficial for them. So they should understand what life is, what is going on, and what is marriage. For them, marriage is their father and mother. It's not marriage. So once they start understanding what is marriage, then only comes the question of what is divorce and what it is going to impact. I mean, what is going to be the impact on them? For them, the impact is that they are not going to have both together, and they both are in conflict. And of course, I know that, and that I think the psychologists will agree that children do sense things when they are very young. Even at the age of 2 or even before that, they start sensing that there is a problem between their parents, but they really don't know what it is. So, and I'm sure that we cannot just tell them about these things at that time. So first the thing is that they should come to an age where they can understand what these kind of relationship are, means marriage. When they know what life and death is, and then yes, go on and teach them or tell them that this is what is happening and this is not about you, it is about them. And yes, the parents also have a role and to maintain that and make them understand that this is what is happening. So
Excellent.
I think we need to wait for some time and then only go ahead and talk about the relationship of marriage or the institution of marriage as such. Yes,
Okay,
relationship and what is
I'd
going on.
like to take this question also to Shalini ma'am. When it comes to a school, you would have got many cases like this. A few years back, a child in a school was found carrying 700 dirhams. And when asked, he was said that my dad and mom are divorced. So when my dad gives me 200, my mother gives me 500. And my mother gives me 500, my dad gives me 1,000. So he actually comes to school every day with 1,000 or 2,000 dirhams, which is mostly like a basic salary of a person. So this concept of divorce, how difficult it is in a school point of view.
Yeah. Thank you, Chris. Thank you so much. I think every family dynamic is so unique and different. So like Dr. said, it's very difficult to say that this is the right way to talk or, B is the way to talk to. I think we have to understand the whole family in a totality. But what we would always, like if I am talking to a parent or consulting with a parent who is about to divorce or has already divorced, would be like have few criterias how they work with their children. Things have to be factual. We cannot beat around the bush because that will create more confusions for the children. So I think giving them very factual information, something that's very brief and their age appropriate information, that would be very good. Divorce is going to create a lot of havoc mentally and they are going to be disturbed. So I think it is a unified effort from the parents to see that their actions speak louder than their words, whether it is showing their love or expressing and informing the children that maybe this decision is the best decision for the whole family. I'm sure the child has witnessed a lot of negativity or difficulty, and that would have led to the divorce situation. So the child is not unaware. He is aware of the complexity of the parents' relationship. So it is better to brief
Sally, we are
them
not hearing.
Am I not audible?
Yeah, now
you are.
You are.
Go on.
Okay.
Please continue.
So only Dr. Danish has not heard me, right? Do I need to repeat anything?
No.
No, okay. So I think it's important to keep children informed in the best age appropriate manner. And I think it is the parents' responsibility to see that their challenges doesn't affect emotionally and in a negative way to their children. So,
yeah,
and
Dr.
these
Danish,
are very common things. Yeah, what you said. The
I'd
example
like to
that you
take this
cited.
again. Yes. In schools, this happens. Now, Dr. Danish, you've dealt with different age groups, I'm sure. So these parents who are divorcing, because I've seen cases where the divorce is an issue, which has an impact from the adolescent age of the parents. So it is an impact of an adolescent, which is affecting another adolescent. So how would you see this adolescent to the next adolescent? This problem is continuing because of a minor aberration, probably a parenting issue or some kind of issue which happened in the parents' adolescent stage.
Okay, like first thing, like how can we introduce divorce and all these things? I would say not to introduce, because like when the time comes, that definitely the child going to ask you the questions, and how much ever he can balance at that time, how much ever he can digest at that time, that information you can give as Shanli rightly mentioned, age appropriate. If he can handle at that time, you can give it that.
Dr. Dinesh, let me add one more thing. These days, what kids talk to me, I get shocked because I don't have that information.
Yeah.
They have it
Yeah,
better than me from Google.
Absolutely.
They will tell me
exactly.
sections of divorce probably.
Yes.
Yes. So it is like if the child can handle it and the child can understand it, that's very well. And we can very well ask him what we can ask from the child's opinion. Like we can ask him directly what is a marriage and what is his understanding. And from then onwards, like we can just add to that being that set as a base, and from there onwards we can like start explaining it things, but how much ever he can understand in that particular age. So the secondly, like for example, maybe after divorce, what happens to me, like who will be there to look after me, all these insecurities will be there, and of course that will come with all this factual information, whatever we can provide from the family side, obviously. And we should have a kind of family therapy kind of setup if the parents are still like together, or if it is already divorced parents. I think of course the child would have overcome that by the course of time. And if it is the child is still going through that process, of course, like we can call other family members to make the scenario very clear to the child according to that his particular age.
There is another, Dr. Salman, I like to come with this aspect where a particular child in one of the cases where he's using this divorce as the bargaining power. Like, you get me an iPhone, or else I'll go to dad. Or he tells dad that, okay, I will stay with you if you get me a video game, all these kind of stuff. So how actually can a mental health worker help the parent cope through the stress? Because it's more than the child, it's the parent going through a stress. He's trying to fill in a competition which is being made by a child as a bargaining power because of a divorce.
Here many times this kind of cases are very challenging case in front of every clinician. I'm believing like that because the lot of family history of discords and mutual harassment, everything happened in the past. Child also witnessed many occasions related to this kind of incidents in the family. So my opinion, if such kind of case is coming to us, we have to cultivate some kind of good qualities in that child. Then how to behave in positive way to elder persons, not father, not mother. Other than that father and mother, how can child behave a good way in front of others? How to show empathy, how to show learn the kindness. This kind of human values we have to try to promote such a child. So maybe there is a change in that behavior in that child. Then our main aim is not to treat that entire family members, but there is a major issue with that child mental health. He is an adolescent, so we have to focus there. We have to mainly cultivate some good qualities in that child. Parallelly, we have to go with marital therapy and family therapy for their issue and this thing. The another thing, a clinician, we have to remember every time, all behaviors learned from the environment. So there is a greater influence in such kind of things. So we have to help that child to meet his friends or any other peer group members with the good qualities. So automatically, my belief is there is some kind of slight positive changes. Then maybe the follow up and sharing the information, it will be upcoming in good way.
There is another question which talks about self-control, improving habits and routine, and overcoming laziness. Now, this is, I really feel this is not just an adolescent issue. Even adults have a laziness issue. So it's a very generic, or say a general topic. How do we actually deal from it? Each one of you needs to add into this perspective, because it has a maybe a psychiatric effect, it has a psychological effect, maybe a school effect, maybe because of different aspects. So starting from you, Dr. Danesh, let's move from one person to the other so that we have a consensus how we can handle this laziness.
Laziness. Like with regards to this particular child, like I think it is they are mentioning about the schooling, right?
Yes, yes.
Maybe, like exactly. Okay. So we need to
There is
start.
also this online issue. They are getting bored of this online classes and they get mental
Yes,
fatigue. That's what the new term they're telling us.
exactly.
A child comes and tells me that I'm having mental fatigue because I'm attending online classes. It's strange.
Yes. Yes. Here, what happens is that most of the children don't know like how to go about this online classes because it's a new scenario for them. And the first priority is that we need to set an environment like a kind of school setup. At least children should have at least one desk and a working atmosphere, just like in school, to work there as per their time schedules, etc.
More
And
of a school simulation.
yeah, something like something they need to have a study table, they need to have a proper school setup, at least a corner of the house, or maybe
Right.
they can use it as like a schooling setup, something like that. And secondly, like of course we need to work on all our like uh, study skills and study habits. All these things need to be changed according to the current scenario now. So study should become a habit, like just like our we are brushing our teeth and we are taking care of our health, we are eating, etc. Like studies also should become a habit, and we need to provide appropriate study habit training, considering this pandemic situation in this particular scenario. Of course, like all the online classes through the setups, etc. And when it comes to laziness, obviously, like we all have the tendency to procrastinate. And maybe I think I am also like expecting some right answer from our dear psychiatrist, please.
Yeah, Dr. Srikumar, let's ask you probably, do you have any anti-laziness pill?
If that was there, I would have taken it first. So, like Daniel said, laziness and procrastination is one of the main thing, and that is why I was not very active in this. Whenever I was called, I was too lazy to come and attend and do things. But then, if the question is only about the online learning and the classes and the present scenario, yes, what Danish said is the right thing. Like we'll have to provide a proper setting where they can have, and on a lighter vein, or maybe later on, we can be using a virtual, what do you call, reality headset where they can be in the classroom.
Excellent.
And,
Excellent.
and,
Google
and that can provide them the visual and the what do you call, audio input of being in a classroom itself and get the feel. I mean, that must be coming up, definitely.
Is that practical, Shalini ma'am?
I'm not sure how it's going to work, because I believe we're all human beings. We need those five senses to work. The touch, the smell, the sight, the colors, and everything. And I think we're deprived of that. And like we say, children are still, their brain is still developing. So it's very hard for them. We take it for granted many of times, like, okay, you're just at home, you're fine, everything should be fine, not giving the scope for children to talk how they are feeling, and each day could still be different as they would be going to school in the real scenario. So I think a lot of encouragement to talk about how the day went and how they're feeling today is very important, to let them out and express themselves. And I think that's how they can provide solutions to their conflicts, whatever problems they're facing. And of course, routine and schedule just helps. I know students who sit at a stretch because it's online. The moment the lessons are over, they go on Googling and doing something else, not realizing how it impacts their posture or their physical health and their mental health. No stretches, no hydrations, no walking and just coming back for nothing. So I think all that can be educated, and hopefully it should get better. Yeah.
Yeah. I'd like to add one thing before I go on to a very sweet comment from Molly Kurvala. what she had written, absolutely right. One of my friends, he came to me for consultation and he asked me that, I want my child to read. So what kind of book should I get her? I said, what kind of books do you read? He said, no, I don't. Then I said, don't get her. Because exactly like Molly Kuruvula said, if the parents are active, the child naturally becomes active.
Absolutely.
But in
Yeah.
cases where the child gets lazy, in spite of the fact that the parents are working or like ripping their head off with work for the child, and the child still gets lazy. Dr. Salman, is there a possibility to counter this in any way?
Can you repeat, Chris?
No, in spite of the fact that the parents are active, the child is still lazy, and the child is feeling that the child is lazy. So, could it be a psychological issue? Could it be any kind of illness, or is there any check to be done if unexplained laziness is there in spite of the parents being active?
Yeah, there may be a chance of multidimensional answer we can give to this issue. Not only the parents are active, then child may express the activity level increased. So what is my point of view? Not necessary in this particular case. We, one thing. The second aspect maybe the presence of any kind of upcoming symptoms of childhood depression or something in the child, then automatically child may go to unreasonable laziness. I think that very detailed Dr. Shaju and Dr.
Study
Sri
yet to be done.
can
Yeah.
contribute in that aspect, I think.
No, one thing.
Yeah.
Since he said that, as a doctor, as a medical doctor, what I would add is, first thing we would look for is any kind of a physical illness. May it be vitamin D deficiency? Could it be vitamin B12 deficiency? Is he having any other physical illness coming up? So many things could be there. And like he rightly mentioned about an upcoming or childhood depression, which is causing the laziness. Because if the child is lazy and if he feels he is lazy, then there is an issue there.
Right, right. I think Professor Molly Kuruvilla also added that, because there could be umpteen number of reasons what goes behind it. And again, the psychosomatic illnesses which could affect, as you rightly said, there could be any other kind of physical ailment which could be a reason. Now, we are actually running short of time because adolescent problems, if we keep talking, I think we can talk till even the next mental health day. We'll still keep talking and we'll still find no a proper end to it. I'd like to add one question, which is a very pondering thought in my head for a long time. How or when a person will identify that the adolescent child or he himself is sad? How does a person detect sadness? Because sadness, it is not just crying. It could be staying melancholy, staying depressed and at a place, staying silent. It could be different ways. So how does a parent identify the sign of melancholiness or sadness or any degree of sadness? Let me start with Dr. Danish. I'll come to Dr. Srikumar and as well as Shalini ma'am.
And first thing, like if there is any particular, like recent changes in his behavior, obviously, if the adolescent's nature itself is a kind of like not mingling with others, like if it is his personality and all, that is different story. But if there is
permissible? Is that permissible in a child, staying aloof? Is that permissible?
No, things like if suppose like sometimes there are a lot of people like they are not very social, not out, like we'll have like introvert persons, and if the child is comfortable and everybody are comfortable with that, no problem. And I feel if there is any changes in his behavior, that is what the primary paramount thing which we need to look for. If there is
abrupt
any
changes, abrupt changes,
recent changes.
Right.
And if there is recent changes, we need to be vigilant to look at for other symptoms. Like for example, I always say, look for parameters. if suppose one person's behavior is harmful for himself or harmful for others, or if it is really affecting his day-to-day activities, of course we need to look at it. And if any behavior patterns or anything if it is not socially acceptable. So this four criteria, if these four criteria are okay with any child, then it is fine. That may be like a kind of he doesn't want to socialize much, that's all. That may be his nature. But if there is any, if it is he's not able to, whatever he has done before, but right now he's not able to do, he was very good in studies, right now there is low grades in studies. So when there is a particular changes to observe, then we need to look for other parameters of other things, if there is any specific symptoms.
Dr. Srikumar, let me come to Dr. Srikumar. The autistic spectrum of patients who have such kind of sadness or being completely aloof, or how well can we detect at the adolescent or a childhood state the autistic spectrum, which can be a reason for this kind of sadness? Recently Bhagya, she just messaged saying that learning difficulties, like dyslexic students, so they will naturally find it difficult to cope up with the others, and sadness could be because of that. So the autism and learning disabilities, how far does it affect these kind of emotions?
It's not a very simple question to answer actually, but then let's start with sadness. See, sadness is a kind of transient emotion where it doesn't last long, and it doesn't affect many areas of your activity. Sadness is something which affects only a particular area. You don't have this, you didn't get this, you heard this news and you're sad. So that is sadness. Whereas the term you use, melancholy or depression, is something much broader than that. And it affects many areas of your functioning, including your physical health and physical energy level, and your ability to enjoy things. In sadness, yes, you are sad about this thing, but then the other thing comes and you're able to enjoy that. Whereas in melancholy or depression, it is not possible. It is a pervasive and all persistent kind of a emotion. So that is sadness. Of course, autism is a very difficult thing where they have difficulty in expressing that. Whether they are just sad about this, or whether they are sad about other things, or they are not. So generally, they are not able to enjoy or express their enjoyment in different ways. So we might actually have difficulty in identifying that, and the only way of doing it is watching or observing the child from beginning itself and noticing his set pattern of behavior, and whether it is drastically changed or persistently changed in any way. And he has become less active. Of course, in those things, he'll become less active and more irritable. See, sadness can also, again, we were talking about anger in the beginning. So this sadness could be the reason for his irritability. So those things have to be this thing. Learning disability, on the other hand, the problem is the child knows that he is not able to grab certain things. And of course, he can be sad about that. Again, what we need to see is he sad only about that particular thing, or is the sadness is pervasive, and is it affecting the other areas? If he's given something else, is he happy about it? And those kind of things. And if he's given help about this learning disability, does he become better? So yes, learning disability would be a little easier than the autistic child to handle or understand.
Shalini ma'am, when it comes to school, everyone is initially sad to go to school, like in our age. Now it is more like after the online stuff started, they want to come to school. So sadness and among students, do you get complaints from students that I'm sad about certain things? Do they come and openly talk to you about it? Are adolescent kids open about their sadness to these counselors in school? The mental illness, mental health should be heard.
Yes. I think it is changing for the better. More children are opting. Like, we do a lot of campaign for, break the stigma about it, be open, talk about it. So we are seeing a lot more students coming and talking. But of course, there are some parameters. When you have to say that, you need a parent's consent to talk, or, have sessions and meetings, So sometimes there is some cases where children are not very open, but generally I see a lot of change in the last couple of years of my work, where they are quite open. They even see it fashionable to talk to a counselor and talk about their problems and things. So in a way, it's working well as long as they come and they discuss their issues and talk about it. So I think it is moving to a positive side. But there are a lot of disadvantage and demerits in the school where, not everybody is open to discussion, especially when it comes to special needs. I think it is our incapability to identify whether the child is really depressed or upset, especially when it comes to dyslexic students or autism. I think many of our adults in the education sectors are now getting trained to know how to handle children with special needs, what are their educational needs. And I think it would get better, slow and steady, definitely.
Right. I would add one thing before I give the baton back to Megha. It is that Mark Manson's recent book, he talks about the success and failure actually does not have any impact on a person. Even if, when a person succeeds, he could be sad. The reasons could be many, and the discussion should keep on happening. And on this mental health day, let the awakening happen. Like when we are imagining a tiger, let us have the courage to wake up and say that, yeah, I was imagining, now I'm okay. So let that change come about. And I really thank every member of the panel, and I thank Healing Minds. I thank Altaf, Dr. Reena, Megha, everyone. Thank you very much for this opportunity, because it is more enlightening, and it is more of a eye opener for me as well.
Thank you.
Thank you.
Thank you.
Thank you so much, Dr. Chris,
Thank you very much.
Dr. Salman, Dr. Shalini, and Dr. Danish, and of course, Dr. Sri Kumar, and Dr. Pooja in her absence. She was missed. This was really great, and I couldn't help myself wishing that I could redo my whole adolescence and childhood, only this time armed with everything that you said, you know. But of course, hey, we are not going to be doing wishful thinking over here, but definitely adolescence is something that we are all going to actively, the age group that we are going to work with, and I look forward to that. We have run out of time, so we are going to quickly wind up the session, and now we have the vote of thanks from Isha. She is the program coordinator with Healing Minds, and really one of the most dedicated and genuine human beings I have come across in a very, very long time. So Isha, over to you.
Good evening, all. Am I audible?
Yes.
Yeah. Good evening, all. On behalf of Healing Minds, I take this opportunity to propose vote of thanks to those who had directly and indirectly contributed to this program. At the outset, I would like to thank Mr. Altaf Ali. Thank you for being a wing beneath our wing. You have made Healing Minds possible. I would also like to thank Dr. Shaju George for your valuable time for us. We are really enlightened with your knowledge and presence. Our sincere thanks to Dr. Reena Thomas and the entire panel team members, Chris Venugopalaya, Dr. Danish Gopalan, Dr. Abdul Salam Chalit, Dr. Srikumar Nair, and Ms. Shalini Krishnadas. Like Megha said, we missed Dr. Pooja also. Thank you so much for being a part of this noble call. And also our heartfelt thanks to the entire team of mental health experts, the volunteers and patrons who made this possible, and also for spending their time and effort with the Healing Minds. Thanks to the PR team, especially Alvina and Mel, for making up these beautiful creations for all of us to enjoy and to spread the word. Last but not least, I would like to thank the audience for joining us today. Without you, we wouldn't exist. If you think there is somebody who needs help and who cannot afford, please refer Healing Minds to them. We are happy to help them. One lit candle can light so many other candles. So let all be that candle in the lives of those around us. With this, we move to the end of the program. This is one of the many programs we plan to do. So watch out our website. We are coming with more and more many activities. Follow us on Facebook, Instagram, and LinkedIn. Yes, Chris? Yes, sir.
I think Bhagya ma'am has something to say. She has raised her hand and she had sent a comment about all these, about a child of 7 years. I actually did not get time to run into a Q&A session for the panel because it would have been beautiful if we had that also. I think Bhagya ma'am has something to say. That's why she has raised her hand now.
Please, Bhagya ma'am. Hello, Bhagya ma'am.
I think she's on mute. Because the comment screen had an explanation about a child, about a 7-year-old, and about the issue of that particular child. So it was very nice of you to have commented. Probably you raised your hand because of the child is sad because she can't meet her friends and teachers in school. So that was one of the reasons added to you. And thank you, ma'am. I really wish we could have had a little more time to interact with the audience also. Over to you, Isha.
Thank you, Chris, and thank you, Bhagya ma'am, because we couldn't reach to you. Sorry for that. In the coming days, as I said before, this is the one among the too many programs we have decided. So do follow us on Instagram, Facebook, and LinkedIn, and to get regular updates of whatever we are about to do. Thank you all for all the members here present here. Thank you so much.
Thank you, Isha.
All right, thank you. That brings us to the end. Good night, and I guess we can all go and have our dinner now. Goodbye.
Thank you, Megha. That was wonderful. Thank you.
Good night, all. Bye, and
Good night.
Bye.
Special thanks to all of you.
Thank you.
Thank you, Dr. Reena.
Thank you, doctor. Thank you, doctors.
So, hi. Not planning to leave? What, Salman? Who's that? Who has entered the waiting room now?
2 people are still waiting to enter. Oh gosh.
Oh, like tell them the ticket is over.
Anita, Sunil, and one name is in Arabic, so I'm not sure.
So you can add the first one, Anita Sunil. You can add. Hi, Anita. We are done. Danish left now. So only who's there?
No, Dr. Danish is there, Dr. Salman, Reshma, I believe.
Any other
few others.
external members, like you can remove them.
Sure.
I think we have to remove all other people.
Or would you like me to start another meeting?
No.
No.
I will remove them. Whoever is not, I'll try and remove them. If they're not wanting to leave us, I don't know. Like, wait.
Maybe sometimes you don't log out and people don't realize, they haven't.
Yeah, I know. They may be busy with
exited.
something.
Yeah, but that's gonna cause problem with our next meeting.
Hi, Reena. This is
Hi, Anita.
here.
We are done. Sorry, dear.
Yes,
You just
yes.
came?
I just tried to come in. Good evening to everybody in the group as well. Sorry I couldn't make it for the meeting.
No worries. You were
Very
one
good
of the
evening.
panelists, right?
Yeah, but I informed Isha I unfortunately
I
had
know.
some
She told.
hospital. Yeah.
I know. So you're
But I
fine now?
just, yeah, getting better, Reena. Thank you so much. I just only tried my luck to see if the meeting is still going on and I could listen to somebody. That's all.
Okay. I don't know why these some names are still shown. I'm removing some of them.
Yeah,
Let
there
me
is
just, yeah.
One is my niece. She's left.
Irina Teresa Laming.
No, that I don't know. I've been removing that. But then, okay, there's
Yeah.
still. She is removed already.
Yeah.
There you go.
Everyone.
So now it's just the 6 of us.
Few of us, right?
Yeah.
Yeah.
6
Dr.
people.
Danish, are you still there?
Yeah, he's there.
Hi, Megha. Well done. It was really good.
Oh, I'm so sorry. I froze at the start of it. It was just, in slow motion. It was moving in slow motion, and I could see it's like a head-on collision. Oh God. So I'm so
It all
sorry,
happens.
Dr. Reena.
Part
Of
of it.
all
You
the
did it so
names,
well.
of all the designations, I forgot yours, and you are most familiar with. So. I made the mistake of thinking, I have, I remember everything, so I don't need to print a paper. And then as I was telling your designation and introducing you, I was opening it on my phone. So it was such a
And
disaster.
I was not here in UAE from 16 years and all. No, I came to UAE 2008.
But somewhere it said you have 16 years experience. Where did I
No,
read that?
no, that was when I was young. Now I have almost 20 years. I've grown
20
older.
years.
Okay, you're somewhere, wherever I got that info from
I think
needs to
some
be
website it
updated.
would be. I think I have to update it. It was all, I don't look into any of these things because I
It's
don't
like
have
it is
papers.
like once you started, once it is live, we cannot do anything with that, and everything is on your hand.
No, but you did really well.
No, I also had a huge
Awesome
distraction with
it
my
was a good
husband,
job.
and he was just munching away to glory while I was talking.
No, Megha, you made it
Who is
possible.
this
You made
Dr.
it possible.
Nahla?
You somehow
Who is this
managed it.
Who is this Dr. Nahla?
Do you want me
Should
to
I
let her in?
admit and tell her that we are done?
Yeah.
Yeah, that's a
Just
better.
admit her and apologize, okay?
Yeah.
No, no need, ma'am.
No,
It's
just
done.
I already did.
maybe
I already did.
You already did? Okay.
Hi, Dr. Nahla. Hello?
Yeah, she is connecting audio. She is connecting audio, I think.
Dr. Nahla, if you can hear us, we finished our session. We just finished. I don't know if you can hear us. Oh, she just gave us sad smiley. We're, sad that you couldn't join us earlier as well.
Maybe next time.
Yeah, for sure. And we'll be doing more of these events. So we hope to see you in the next one.
Doctor, where do you work, by the way?
Doctor, please unmute and talk.
If possible. Otherwise, you can just type in the chat. Any registration for the event? No, this time around we didn't have registration. Available online to watch. By the way, this is still getting recorded. Somebody needs to tell me how to. Let us figure that out, Dr. Nahla. If you can leave your number in the chat, I will get back to you on WhatsApp personally and let you know. If we can arrange for you to watch it, we will have to see with the team and I'll let you know.
Yeah, we will leave it in our website.
Okay.
So we will leave it in our website so you can access anytime later.
Good evening.
Good evening.
Sorry, I'm unlucky to can't join with you, but now the chat is disabled. Where can I write my WhatsApp number?
Oh, okay. Just say it out to me. I'll note it down.
Say it now orally?
Yeah, sure.
Yeah, exactly.
Okay, thank you so much. 0,
0,
1, 0, 0.
0, 1, 0, 0.
Yeah, 3,
Okay. 3,
8,
8,
3,
3,
0,
0,
7,
7,
2, 1.
2, 1.
Yeah,
Where are you
Egypt.
from?
Egypt. I think you should add the 2 at the first. I think 2. The code is just
The
0, 2
code.
or 2. Yeah, 0, 2 or 2. Egypt, you should add 0, 2 or only 2 at the first before the number.
Okay. Okay. So 0, 2 before the number, which is 0, 1, 0, 0, 3,
Yeah.
8, 3, 0, 7, 2, 1.
Yes.
So you're based out of Egypt?
Sorry?
You're based out of Egypt? You're working in Egypt?
Yeah, yeah. I'm from Egypt, yes.
Nice to meet you.
Nice to meet you too. Thank you so much. I was unlucky, just I was informed about the session lately.
No worries, no worries. We will, catch you up in another program, and you can access us in the website.
Yeah, okay. Okay, the website, sorry, its name? Or the Facebook, any Facebook page, the sessions may be downloaded.
Danish,
on
can you
Facebook.
tell her the FB page?
Sorry?
She
Facebook
can
page?
she can reach us Healing Minds. Our website, you can check all the informations are there inside.
Okay, our website is healing-minds.org. That's HEALING
Healing,
dash
sorry. Healing dash, okay.
minds, MINDS.
Mind, healing dash mind, okay.
Mind with an S, yeah?
Mind, sorry, minds up.
Plural,
Minds.
yes,
Okay.
healingminds.org.
.org, okay.
Yeah.
Yeah, okay.
Sure. So you will have all our Instagram, our Facebook, our WhatsApp
Facebook,
details.
yes. Facebook, yes. And WhatsApp, the same number I told you. And Facebook, yes. Can I tell you the name, the full name of Facebook, or you can send or write your
It's there
Facebook
on
page?
our Facebook and Instagram details are there on our website, so you can just
Join through it.
Yeah, you can follow us through it.
Okay.
Yeah, that would be easier. Yeah.
Yeah. Okay. So kind from you.
Sure,
Thank you so
sure.
much.
Thank you.
Thank you.
Out of curiosity, how did you find out about us?
There was for Egyptian group, Egyptian WhatsApp group, they collect, if they know about events, and now most events are online, they send to anyone who wanted to join. But sometimes the times are different.
Yeah,
sure.
I get
From
it.
area to another.
We all are working, right?
Yeah, you wanted to modify the time.
Sure. Next time we'll make sure to mention the time area, like it's Dubai time or whatever, so people can
Yeah, it will be
figure that
easier
out.
to join accurate time.
Yeah, well, we weren't expecting, honestly, to go international. So we are very happy that we, made it to your group and you found out about us. So we'll make
Yeah.
sure to take that into account next time, because
Yeah.
we were aiming mainly for mental health professionals and people in the UAE. We work in the UAE, so that was our target audience. But in the future, we'll make sure to add that.
Yeah, okay, and Facebook makes communication easier all over different, different countries. Yeah.
Certainly.
Okay. Nice to
you.
chat with you.
Likewise.
Thank you so much.
Take care.
Thank
Bye.
you. Okay, bye. Bye. Good night, everyone.
Good night.
Good night.
Good night. Bye.
Okay.
That was one of the wonderful participant.
Reena, can I leave then? Because I
Yes,
think
dear.
you panelists are there
Yes,
on.
dear. We all are leaving. We all are leaving.
Yeah.
Yeah,
Good
yeah.
night,
I just
Salman.
I had to.
Good night,
Yeah, good night,
Ganesh.
Anita ma'am.
good
Good
night.
night, Reshma. And
Good
this
night.
is our new host, right?
Yeah,
Yeah, she's
Mega
a
is
Mega.
new
our
team,
Yeah.
team member.
Sorry,
Yeah.
sorry. I have learned
Welcome,
my
welcome,
lesson.
welcome.
Make printouts for everything you're about to say. So
No, but you sound very nice.
No,
So
no.
let
but
me
You
try.
she done
did it
very well
awesome,
today
Mega.
for
sorry.
us. You
You did
done
it awesome.
very
Yeah,
well.
Thank
you
you.
did very, very nicely. I'm
I'm
glad.
just here for the last few minutes, but you sound really good and we feel it very professional. So keep doing the good job for us.
Thank you. Thank you.
Yeah.
I am from the media background, so it's
Excellent.
I
So
have
you
done
and
this
Chris
many times.
made it actually from the media people, right? So
Chris
you guys
was
made it. You guys rocked it.
unbelievable.
I
Chris
like
I
very
was
much that
holding myself
introduction of Chris.
together because my video was on, but he was unbelievable. I mean,
He was. I used to admire him when I had my first interview. I was so scared to go in because
my
it was.
God.
Then I didn't know what to do over there. But he's such a nice gem. And
Yeah,
then
but
I
he
knew
takes
that
care of
was.
everyone and he takes everyone along, Like
Yeah.
he is, of course, extraordinary, but the beauty of his skills is he will bring the best out of each person who's there, which is so, and without even realizing, So I learned so much. He's incredible, my God.
Yeah, I think we
I
should say that he's the one who kept the core group going for a long
Yep,
time when we were all
definitely.
not active.
I
So
think he
that was a
still
very
does
good.
with his motivational
Yes,
messages,
every day in the morning we get up to see that.
He plants a little seed over there.
Yeah.
So
Even if nobody replies, he still keeps on doing. So that's really very inspirational.
He does that always.
Yeah.
He doesn't take it in, he doesn't bother, but then he extends his support
Yeah,
for
his
anyone.
side. Yeah, that's really nice and kind.
One of my
I was
best
happy that
assets in
he
life
said
is
that
him.
I was happy that he agreed to join us, of course, on panel. So I just thought of like, okay, let him lead the panel like that.
Yeah.
He did that beautifully.
Yeah,
Yeah.
that's
All of, and Isha also. Awesome.
Yeah, Isha was why how she left? How come she left? Maybe she did beautifully. Yeah.
good. So
Congrats to both of
good
you and
everybody.
welcome, officially welcome.
thank you.
Myself
Pat on everyone's back. Well, okay, please, somebody, can you walk me through how to, recorded video. I opted for save on my computer. So now if I stop recording, what will happen? Will it just automatically get saved?
It will guide you. It will guide you. No problem. It will guide you.
Okay.